How to treat and cure bad breath. Halitosis, commonly known as bad breath, is an embarrassing health condition that affects approximately 30% of people around the world. Additional medical terms for this condition include stomatodysodea, fetor oris, and oxystomia. Regardless of the term used, this is the presence of a foul-smelling odor that seems to come from the mouth cavity. According to the Academy of General Dentistry, in more than 90% of cases, the odor originates in the mouth, throat, and tonsils. Although this is something everyone experiences at one time or another, if your case does not improve after brushing, flossing, and rinsing the mouth with an alcohol-free mouthwash, it may be chronic. The foul oral odor is usually caused by a group of anaerobic, sulfur-producing bacteria that breed beneath the surface of the tongue and often in the throat and tonsil area. The term anaerobic literally means living without oxygen, and in fact, these bacteria do not require oxygen to live. They occur naturally in the oral environment and are essential because they assist in digestion by breaking down proteins into amino acids. Proteins are commonly found in food, mucus or phlegm, blood, and in diseased oral tissue. As these bacteria feast on proteins in your mouth, sulfur compounds are released from the back of your tongue and throat. The bacteria excrete waste as hydrogen sulfide, methylmercaptan, and other odorous and bad-tasting compounds known as volatile sulfur compounds. As long as the anaerobic bacteria feed on proteins and excrete volatile sulfur compounds unchecked, your breath will become worse and worse. There are many underlying causes of halitosis, but 4 of them are very common. Dry mouth xerostomia, the medical term for dry mouth, provides a perfect environment for anaerobic bacteria reproduction. Long periods of speaking, smoking, drinking alcohol, and snoring are a few common underlying causes. Most people experience foul breath in the morning due to lack of saliva production while they sleep. For healthy individuals, food odors are temporary and normal salivary flow will eliminate them within several minutes. However, those who suffer from dry mouth and lack of saliva find that even minor food odors may lead to long-term issues. Foods halitosis can be made worse by certain foods such as onions and garlic because they contain smelly sulfur compounds. While dairy, meat, and fish contain dense proteins which are used as a food source by the anaerobic, sulfur-producing bacteria. Refined and processed sugars also provide a food source for bacteria. Coffee and juices can contribute to this problem because they are acidic and provide these bacteria with an ideal breeding environment. Poor dental hygiene and inadequate oral care causes bacterial buildup on the teeth and gums. Teeth cannot shed their surfaces the way skin can, so microorganisms can easily attach to the teeth and remain there for extended periods. If not continuously removed by adequate brushing, these bacteria develop into something called biofilm, commonly known as dental plaque. When plaque is allowed to accumulate near the gum line, it will harden and begin destroying teeth and gum tissues due to intense bacterial activity. This leads to gum disease such as gingivitis and periodontitis, which enable proteins from bleeding gums and diseased oral tissue to fuel odor-causing bacteria. Tooth decay and poorly fitting or dirty dentures can also contribute to this problem. Illness and disease. According to studies, in approximately 10% of all cases, halitosis is caused by certain illnesses. Individuals who suffer from diabetes, lung disease, kidney disease, cancer, liver disease, respiratory tract infections, or metabolic disorders often experience chronic foul breath due to dry mouth. Sinusitis, pneumonia, bronchitis, postnasal drip, and polyps affect the airways and may also contribute to the problem. Other common illnesses associated with this problem include nasal odor and tonsil stones, yeast infections of the mouth, and gum disease. Certain drugs such as antidepressants, high blood pressure medications, and antihistamines can factor into dry mouth because they reduce saliva production. If you wear dentures, remove them at night and clean to get rid of bacterial buildup from food and drink. Drink plenty of water and swish cool water around in your mouth. This is especially helpful to freshen morning breath. Brush after every meal and floss, preferably twice a day. Replace your toothbrush every 2 to 3 months. Arrange regular dental checkups and cleanings. Scrape your tongue each morning with a tongue scraper or spoon to decrease the bacteria, fungi, and dead cells that can cause odor. Hold the tip of the tongue with gauze to pull it forward in order to clean the back of the tongue. Chew a handful of cloves, fennel seeds, or anise seeds. Their antiseptic qualities help fight halitosis-causing bacteria. Chew a piece of lemon or orange rind for a mouth-freshening burst of flavor. Wash the rind thoroughly first. The citric acid will stimulate the salivary glands and fight bad breath. Chew a fresh sprig of parsley, basil, mint, or cilantro. The chlorophyll in these green plants neutralizes odors. Try a 30-second mouthwash rinse that is alcohol-free, unlike many off-the-shelf products. Mix a cup of water with a teaspoon of baking soda, which changes the pH level and fights odor in the mouth, and a few drops of antimicrobial peppermint essential oil. Don't swallow it. Yields several rinses. Advanced oral care products. Use oral care products such as mouthwashes and toothpastes that have been shown to be effective in fighting bad breath. Proper oral care. Brush and floss your teeth at least twice a day. Be sure to get a toothbrush with soft bristles, as to not damage tooth enamel or gums, and also use fluoride toothpaste. Brushing and flossing helps to remove any food and plaque which can be used as a fuel source by the anaerobic, sulfur-producing bacteria that are at the root of this problem. Stimulate your salivary flow, prevent dry mouth with chewing gum, lozenges, or mints that are sugar-free. Look for xylitol, a non-sucrose sweetener, which in recent years has been shown to have anti-cavity properties. Eat fibrous fruits and vegetables. One of the best ways to remove bacteria in the mouth is to eat an apple a day. It helps moisten the mouth, too. Take a dietary supplement. Vitamin C, vitamin D, vitamin E, and vitamin B are effective at helping your body eliminate excess mucus and toxins naturally. Brush your teeth occasionally with baking soda. The bacteria that cause bad breath thrive in an acidic oral environment. Brushing your teeth with baking soda helps neutralize excess acids found in the oral cavity. Eat foods rich in fiber. High-fiber foods actually help prevent halitosis. Avoid eating heavily processed foods that contain refined carbohydrates such as cookies, cakes, sweets and ice cream. Use mouthwash. Some mouthwashes or oral rinses are effective at preventing bad breath. However, you should never use alcohol-based mouthwashes because the alcohol makes the mouth very dry, which will actually make the problem worse. Drink green and black teas. They contain polyphenols that help eliminate sulfur compounds and reduce oral bacteria. Avoid drying medication. Try not to take antidepressants, diuretics, pain relievers, and antihistamines unless it is absolutely medically necessary. These drugs inhibit saliva flow and can cause chronic dry mouth. Avoid products with sodium lauryl sulfate or alcohol. Do not use any oral hygiene products that contain sodium lauryl sulfate or alcohol because the alcohol makes the mouth very dry, one of the most common causes of bad breath. Clean your mouth after eating meat, fish or dairy products. Practicing consistent and thorough oral hygiene is an effective prevention tool. Stop smoking. Studies have shown that smokers are at higher risk of developing periodontal disease and dry mouth. Furthermore, people who smoke may also engage in other habits that promote this condition such as dieting, drinking alcohol, and suffering from chronic anxiety conditions that require exacerbating prescription medications. Breathe through your nose instead of your mouth. Try to address any snoring or sleep apnea issues that could be affecting your breath and causing dry mouth. Drink water. Keep your mouth moist by drinking plenty of water. Clean your dentures at least once a day. Practice the same, proper oral care that you would with your original teeth. Eliminate dairy products from your diet. Lactose intolerance can be an underlying cause of halitosis. Use an oral probiotic like S. salivarius K12 and M18. Use probiotics to balance the oral cavity and prevent an overgrowth of the odor-causing bacteria involved in halitosis.